Hello, my name is Sanjay Gupta. I'm an emergency physician and the program committee co-chair for SAEM 25. It is my pleasure to introduce Chuck Carnes today. And Chuck Carnes is the Walter H. and Lenore Annenberg Dean of the College of Medicine and Senior Vice President for Medical Affairs at Drexel University. And Dr. Carnes is our keynote speaker for SAEM 25. He is a leader in emergency medicine, critical care education, and translational research. At this year's SAM annual meeting, he'll be delivering the prestigious Dr. Peter Rosen Memorial Keynote titled Advancing Precision Emergency Medicine, Innovations in Translational Medicine and Population Health. Dr. Carnes, welcome. Thank you for joining us today.
Hey, Sanjay, great to be here. Thanks for doing this interview, and thanks for all you do for SAM.
No, I appreciate that. So in just kind of reviewing your talk a little bit, I found it very interesting. To start, can you give us a high-level overview of your keynote address? What will the key themes be and takeaways that the attendees should expect?
Well, the key takeaway is that emergency medicine has just had an extraordinary impact, not only on American medicine, but global medicine. And it's been extraordinarily innovative and impactful. So the idea is, what's that next step look like? What do we do from going from algorithms that have changed the world and saved countless lives in trauma, cardiac arrest, sepsis, and see what we can do for individuals for all diseases across all geographies. And so trying to live what anything, anywhere, anytime for anyone really means in emergency medicine in this age of the digital transformation and extraordinary new opportunities in science, medicine, and public health.
All right, thank you for that. That sounds very exciting. So with this, as this sounds like it's a very innovative talk, how would you define precision emergency medicine? And how do you think its implementation will impact the future of emergency care?
We know, Sanjay, it's really interesting when you think about the impact of emergency medicine. We've done such a phenomenal job of taking care of patients with a large swath of diseases. Think about cardiac arrest, think about trauma, and dedicated geographically based systems of care for those patients and populations. But a lot of that work's been based on algorithms. And we know there are still treatment gaps. We know there are diagnostic gaps. And there may be opportunities beyond those diseases to make a difference. And so the idea of precision emergency medicine is to be able to treat patients as individuals within a particular geography. And based upon those kinds of characteristics, provide the best optimal care, the most efficient care. And in the broad spectrum of medical care globally, think about how we do that most effectively, most efficiently, frankly, most financially viable in a way that will impact the rest of their life. So the idea is to bring an individualized, personalized approach to the care of patients and the management of these patients in this broad population, just given all the factors that might lead them to the emergency department or in the geography they live.
Wow. I mean, I'm getting excited just hearing about this. So I can't wait for SAM 25. So with the advancements in digital transformation and big data analytics, how can emergency physicians leverage data and technology to enhance their clinical decision making and improve patient care with the precision emergency medicine approach?
Well, I do think that there's an enormous opportunity, right? Given advances in big data, given advances in machine learning, what we deem artificial intelligence, and applying that to the care of individual patients, but also in terms of the context of care within a hospital or a geography system like EMS. And so thinking about how it can enhance diagnostics is an immediate one. I was involved in the first interpretation using computers for EKGs, and now we're able to use large language models to better inform what kind of patients and what kind of entities might be looked at through EKGs, and then using these novel approaches to analytics to identify disease states even beyond cardiac disease. And so that's one example. And similar movements are being done with other technologies we use daily, things like ultrasound. And then there will be opportunities to better understand the types of patients we see and identify diseases that we may not recognize. That old saying, when you hear hoofbeats, think horses, not zebras. Well, the fact is there are a lot of people with rare disease zebras who intersect with our emergency department. Maybe we can identify them earlier and more accurately. And then, of course, how can we use all these data points to make our lives better, both as providers as well as for our patients and the populations and their families and employers? In other words, what's the most efficient way to take on the needs of patients with acute life-threatening diseases and injuries, but also those who come in for access reasons or for other episodes that may not be as severe. So I think these are all the kinds of opportunities we have when we embrace the digital transformation for diagnostics, for care purposes, and frankly, to help us provide services. Imagine all the challenges of EHRs these days and other kinds of documentation that might be enhanced by using digital voice assistants, for example.
Oh, wow. Thank you for that answer. So, in thinking about your keynote speech and the legacy of Dr. Peter Rosen, looking ahead, what advice would you give to emergency physicians and researchers who are eager to contribute to the future of precision emergency medicine?
Well, first of all, you picked a great field, right? When you think about the field of emergency medicine, we get to see everyone with all these diseases, and we get to see them on an ongoing basis on a true population-based approach. So when we think about the post-COVID lessons that we can't leave populations behind, well, emergency medicine, we get to live that. And we also get to have the largest impact because we can take these innovations across multiple disease states, multiple new therapeutics, multiple new diagnostics, and really make a difference. So I think the field of emergency medicine is well poised for this. So I think the second one is embrace it, right? I think go ahead and not only lean in to the digital transformation, you won't necessarily have to learn how to code, but at least be familiar with what it is and keep active in terms of the developments of technologies. Now, emergency medicine's always been really good at this. I mean, we brought in the idea of ultrasound to care for huge populations, and it's created a revolution. But I think there'll be multiple other technologies that you can get involved with. And the third one is please embrace scientific developments in addition to technological developments. You know, I personally have been involved with doing research that started off in metabolism, and that led to an interest in proteomics, genomics, and how we might use systems biology to take care of patients. And it was incredibly complex, and I'll have some examples in my talk. But now we have the computing to be able to literally use that all for a single patient at a single point in time and really have the kind of precision in our understanding of that human's physiologic state in a way that make an impact for their life globally. So please embrace not just technological advances, but also scientific advances. And of course, be friendly, be open, do what emergency physicians have done so well, and that's take care of everybody for everything and be prepared to do that anytime, anywhere. I think that's the opportunity for researchers and innovators in emergency medicine, Sanjay.
Oh, very inspiring. Thank you so much for that. So, in thinking about precision medicine and population health and its intersection, so what role do social determinants of health play in precision medicine? I mean, are there ways that technology and the data-driven approaches can help address disparities in emergency care?
Well, we certainly know disparities exist. And frankly, emergency medicine gets to see them every day. And all these factors, whether it's socioeconomic factors, whether it's environmental risk factors, whether or not it's just not having access to care and ongoing management of chronic diseases, puts a lot of people at risk, and many of them end up in the emergency department. And so I think we have to take on all these issues. There are ways for big data to take a look at risk from geographies. There may be ways to take a look at big data and understand when someone's chronic disease isn't being well managed. And frankly, thinking about that as a continuum of care might be a new role for emergency medicine because we get to see when the disease has a manifestation that's acute, but certainly we can contribute to the ongoing management solutions. And then finally, I do think there'll be a day for emergency medicine to play a role in prevention. And this may be through proactive strategies on disease modifiers, but it also might just be identifying those at risk. Because one thing about emergency medicine is we'll take care of everyone. And so when you're in a geographically defined space, I think that's the ultimate extension of applied public health. And imagine the opportunities for everything from disease management and intervention, but potentially to prevention. And so embrace these new approaches. Let's get some new data sets. We've been spending a lot of time getting data from broader community sources than just medical records in order to try to do those things of prediction, resource assessment, and of course, opportunities for prevention.
All right. Thank you, Dr. Carnes. So, I've always found that emergency medicine is always at the forefront of medical innovation. It's part of what we do, right? Is being innovative. And, we often need to adapt rapidly to new technologies and treatment protocols. So, in your mind, can you share some of the most exciting biomedical innovations currently shaping emergency medicine?
Well, I must tell you, I've been very impressed by some of these new technologies and the applications of new approaches. I highlighted earlier electrocardiograms. Since I was involved in that early computerization electrocardiograms, it's amazing seeing what we can do with large scale models and machine learning techniques to understanding diseases outside of the heart using electrocardiograms and doing risk stratifications in ways that otherwise weren't available. Certainly with ultrasound, we've now explored all the uses of acute ultrasound to the benefit of patients. But imagine if there might be more. Imagine if we might think about how we can now direct therapy. And one of the areas I've been interested in is how can we change the trajectory of disease? And looking at that kind of outcomes approach to technologies that are utilized in emergency departments in a way for a longitudinal perspective. And then finally, we need to do something about just the massive data we deal with. 20% of the data we have, is really structured. That other 80% isn't. And so you think about all the decision making we have to make and all the information we bring into EHRs, couple that with the information we get from laboratories, from EKGs, from radiologic studies, and think about how we can make decisions faster, better, more accurately, and honestly be more efficient in our diagnostic workup. That'll benefit not only our systems and our overworked hospital systems, but also contribute to better understanding and potentially quality of life for patients and families. And we should be able to do it at a cheaper cost, because one of the things we are really good at is making decisions, sometimes on incomplete information, and being right most all the time. Imagine if we can enhance the quality of that information, make those decisions even faster, better, and more efficiently.
Yeah, no, that's very inspiring because we think about the adaptation of technologies in the emergency department. Unless there's a value add, and that value add are the things that you just spoke about: efficiency, quality, great patient care. This is, it turns into a challenge, offering these. But it sounds like with your talk and what you're going to have to offer, it sounds like the future of emergency medicine is looking very bright. So, if you had to leave the audience with one key message about the future of emergency medicine, what would it be?
Emergency medicine is so well poised to be the field that really embraces innovation, that will have the most impact, and will be able to claim that we're there at the forefront to see everyone for anything, anytime, I think anywhere. And that will be our position in the House of Medicine, is to do it for everyone, for anything, and really be proud and honored of the impact we have.
All right, Dr. Carnes, thank you again for your time today. Your insights into precision emergency medicine and the future of emergency medicine with the introduction of new technologies and population health approach. This has been really valuable. Really looking forward to your keynote at 2025 in Philadelphia. All right, thank you so much.
Thank you so much, Sanjay. Thanks for your leadership of this program. Looking forward to seeing you in Philadelphia.
Yeah, looking forward to seeing you.